What's up, y'all? This is Not a Real Doc TPT, and today we're going to be talking about a continuation of the expectation for your physical therapy series that we did just a few weeks ago. It struck me that I left out a really big part of that entire series that definitely cannot be neglected. We definitely got to touch base on this, and that is, what are the expectations that your doctor of physical therapy has for you? Yes, there are some. Yes, it's important that you participate with us. So we can't move on and start going into other topics without us fully addressing what expectations should come about with your therapy care. So that's what we're going to be talking about. So number one, the first and most obvious thing is that you don't actually cancel or miss appointments a whole bunch. We certainly understand patients get sick, appointments come up, things happen. You're not able to get a ride, or um, you know a myriad of things can come up. Physician appointments pop up, etc., etc. We understand all that. That is expected. It's a normal part of life. No big deal. What is a big deal is when you have those types of occurrences happen and you don't try to make up those visits. You If you're going to have a miss visit, if you're going to have a cancellation, it's really important for your therapy care that you make up those visits at some point. Um, so I, we don't need to go into that any further, but that's really important. Show up for the visits that you're supposed to be having, or if it's a home health physical therapy, allow those therapists to actually come to see you. If you're in skilled rehab, if you're in acute care, don't turn them away. Don't say I don't want to get out of bed. Actually, let them work with you, okay? And don't do a cancellation. So, what's the old saying that half of the job or half the battle is just showing up. So that's number one. Number two, when you do show up for your appointments, be on time. Now, I am the my wife will laugh at this as being even a point in this. I am definitely not one to talk about being on time for everything and what have you. However, don't do as I say, not as I do. Uh, when you're coming to your physical therapy appointments, it's really important that you show up on time, especially in the outpatient world. In outpatient, we've got you're want to think about it as a little bit of a train moving through a station, and if somebody is late, then that just backs the entire thing up. So really important that you show up and that you show up on time for your scheduled appointments. If you're having other physical therapy care being done, it's really in acute care. That's probably not quite as important, although it is important that the therapist be show up maybe around your dinner times and lunch times and those types of things. They need to coordinate around that. So uh, that's a little different. In home health, it's also going to be a little different in that the therapists are actually showing up for you. Um, those therapists actually might be uh, not always on time because you don't always know exactly how you're going to be, how long you're going to be with the patient in home health. But for outpatient physical therapy, if that is something that you are doing as a patient, try to be on time. It's really important. All right, number three is we're going to give you a series of exercises to do. Um, the When you're with us in that appointment, whatever that is, whether it's home health, whether it's outpatient, try and give effort for us during that time. Don't just halfway go through the motions. Don't just give poor effort when you're actually doing the exercises with us. Um, it's You're not going to get anything out of it. So, physical therapy care, it is hard work that you do. and that we're helping you, we're helping to guide you, we're helping to do the right things, we're helping to apply the best exercise or best therapy treatment, whether it's manual therapy, etc., to the condition that you have at the best time, so that your body can be put in a position to heal itself. That's how physical therapy works overall. It's hard work. You're not going to get around that. Yes, at times it might hurt a little bit. Yes, it's going to be difficult and challenging at times. However, it's not however, it it is critically important that you go through the process and actually give an effort and try during the exercises and the activities that we're giving you for your therapy treatments. That's going to be really important with us on what you're doing and the day-to-day appointments. And we'll be encouraging you. We'll be helping you to do that. But it's even more so in the home exercise performance that you're going to be expected to do. You cannot get around needing to consistently work the area that you are trying to rehab consistently, daily, multiple times a day, often and typically. And so when you're doing that, it's really, really important that you actually giving an effort and actually trying. That does move on right into the fourth thing that is critically important for your success. It's also one of the expectations that we have for you as physical therapist, and that is that you actually do the home exercise program when that we give you. Do the work. Actually, if you do the work, you'd be surprised how well you'll actually do. And this is probably going to wind up being a video topic all on its own. But we have so many patients, and I am certainly not the only therapist that experiences this. I know that because I talk to plenty of other friends that are therapists that go through the exact same thing, which is we'll show up, we'll do our part, and try to help you the best that we can, give you everything that we can to try to help you in your condition. Then we'll give you a nice written home exercise program for you to follow, only for you to come back in therapy when we talk to you about the home exercise program, you haven't done it at all. Or you might, sometimes patients will try to say that they've done it, and then we'll ask them like, okay, go ahead and let's start with that, and then we'll progress from there. And we can tell if you've never done that before. It's very obvious if if we've given you something that you should have been doing over the last 3 to 4 days, then when you come in, if you're not doing the right form, or if you're not, we can tell. You're not going to get away with that and pretend that you've been doing it. So really important, and a big expectation for your physical therapy care that your doctor of physical therapy will have for you as a patient, and that is that you do the home exercise program as we are telling you to do it. Do it the number of times. Do it. We generally will give you a range. We'll give you a rep range. Give you a certain number of times per day that you should be doing it. Follow that. Do that. All right. Last thing that I'm doing in this is kind of just a quick hit kind of video on the expectations that your therapist will have for you as a patient. Last thing, trust us. Give us the benefit of the doubt. I'm going to say there are in several different manual therapies that you might be experiencing with us, whether that's going to be potentially dry needling services, whether that's going to be myofascial work, especially with myofascial work, whether it's going to be a scar massage, a host of conditions. You're probably going to hurt while we're doing that. Trust us. It is pain with a purpose. There is a reason that we are doing that. Now, I've talked about this a little bit before. We're not going to exceed your pain thresholds. We're not going to exceed your pain tolerance. At least we shouldn't be. If we are, then that's bad physical therapy, and you shouldn't be working with us. But in general, if you're working with a responsible, good physical therapist, they're going to be very attentive and very attuned to how you're experiencing the manual therapy treatments that you're being given, or not even manual therapy. Some of the exercises you're going to be doing, yeah, they're going to hurt. It's going to be difficult. As I mentioned before, it's hard work. Trust us. Trust us. Do what we're asking you to do. That is probably the most important expectation, we'll say it's the number one expectation that your doctor of physical therapy is going to have for you in your physical therapy treatment. Trust us, let us help you. It's like Jerry Maguire, help us to help you. All right. So I hope that this has been a quick kind of video, but I hope that those 5 points help to maybe clear out some questions as to what it is that you should be doing in your physical therapy care. So if that is something that's beneficial to you, and if you like having some commentaries on physical therapy, maybe learning some tips and tricks to having successful physical therapy care, then we ask that you would subscribe to this channel, that you actually would like and give us a thumbs up on this video, and help us to grow this new channel as we're trying to reach out and touch as many people as we can with some educational and informational videos on the field of physical therapy. All right, y'all have a good one. We'll catch you next time.